Hi everyone. Today I would like to introduce our project to you, the application of smartwatch monitoring to construct an overwork prediction and alarm model for emergency healthcare professionals. It's sponsored by Moss Joint Research Center for AI Technology and O Vista Healthcare. The PI is Chen Mingxian, Professor and Executive Vice President of National Taiwan University. The co-PI is Huang Jianhua, Professor of National Taiwan University and Director of Department Emergency Medicine, National Taiwan University Hospital. The second co-PI is Lu Zhongqian, Assistant Professor of National Taiwan University and attending physician of National Taiwan University Hospital. In this slide, we will address the pain point, finding, scenario simulation, technology introduction, scientific results, scientific breakthroughs, technology adoption, and our project team members. Pain point. According to international standard of nurse-patient ratio, its ratio is 1:6. But the nurse-patient ratio in Taiwan is higher than the international standard, no matter in medical center, regional hospital, or district hospital. Furthermore, it causes short-term impact. For example, concentration and avoiding distraction, lateral thinking and resolving power, decision-making capacity, capability, weakening to recognize risk, and so on. However, the long-term impact could cause healthy problems physically and mentally. Anyways, overwork causes increasing the risk of medical error and healthcare personnel suffer from sudden death. Finally, it brings negative impact on the whole healthcare quality. Our finding. According to KPMG's research for global new crisis in healthcare in 2019, the estimated global medical manpower demand will reach 80 million people in 2023. But the WHO predicts that the lack of healthcare demand will reach 18 million people. As you can see on the right side, the unbalanced demand and supply on healthcare manpower causes the virtuous circle take place repeatedly. So that we plan to use AI technology to resolve the problem. Our solution. By collecting the change of kinds of vital signs, we combined the results with testers' fatigue scores, which belong to the matches fatigue types and their basic profiles, with machine learning algorithm to auto-optimize regression analysis. Finally, we come out correlative features between vital sign and fatigue, and the overwork model to push overwork warnings as our deliverables. Here is our scenario simulation. With diverse IoT devices deployed in the emergency room, the manager also could tell which employee is under overwhelming workload and pressures by the over fatigue prediction model. The research outcome could benefit the manager on medical personnel manpower adjustments for avoiding any unnecessary tragedy happens. The research's long-term goal is to benefit the emergency department on reviewing human resource utility and arrangements so that the hospital could enhance the resource management and provide a better working environment and medical service to medical personnel and patients. Technology introduction. The page shows briefly how many vital signs measurements we used and use fatigue scores to classify the fatigue types for coming out overwork case groups. Taster demographic. By collecting the doctors and nurse vital sign data in 2 months period, we come out 4 types of bar charts, including age, gender, role, and work shift. Female nurse in the age between 25 and 35 years old are the majority of the testers. Feature engineering and selection. We use feature engineering to select the important features for the final model. The method includes extracting time series data by applying statistical functions, concatenating the vital sign features and demography features, then doing the feature reductions. Machine learning algorithm and learning technique. As to the algorithms, we use SOTA tree-based models for lower affection from missing values, independence to feature scale, and normalization. Use regression for determining the indicator of overwork. Using binary classification for detect overwork testers. We split the sample into 70% training and validation set for cross-validation and 30% testing set. Scientific results. The scientific result shows that physiological data is the key factor to analyze the change of the fatigue scale at duty and off-duty time. The AUC of overwork index could reach 0.8 or higher in the testing set when we exceed 2 standard deviations of the distribution of all fatigue difference in duty time and off-duty time. When we restrict the nurse group in the age of under 35 years old, then the AUC classification for overwork over 2 standard deviation reach 0.94. Scientific breakthroughs. With machine learning algorithm to auto-optimize regression analysis, finally we come out the correlative features between vital signs and fatigue, and the overwork model as our deliverables. Besides, if we set the alarm limit of overwork according to the fatigue score difference between on and off duty, then we could classify the overwork cases. Changes of fatigue scores greater than 2 standard deviation with AUC to 0.94 from our best machine learning classification model. Technology adoption. Our purpose is to adopt AI technology to develop medical personnel's overwork model, which could auto-optimize itself for general application. The overwork detection model could be adopted not only in hospitals in Taiwan, but also in relevant institutes abroad. The Ministry of Labor mentioned that the average of annual working hours of employees in Taiwan equals 2,028 hours, which is top 4 in global ranking. If the service could be designed as a personalization service, the value of the prediction model could be maximized. Besides, the type of prediction model could be adopted in similar scenarios in healthcare centers or other hospitals. We are looking forward to the methodology and the concept could be spread and adopted in different domains for benefiting labor safety and reducing avoidable occupational injury. Our project team members including computer science experts in AI expertise, medical professionals, and project management. If you have high interest in our project, just feel free to contact us. We are looking forward to hearing from you. Thanks for your time.